Are there still, do you suspect, a high number of cases, especially in the young people, asymptomatic? They never know they had it. And are they spreading it? I mean, is the jury still out on that, or?
Well, with the Delta variant, I would say that's probably true. We still see about 85% asymptomatic carriers, that don't know they have it. And that's okay because it means at least they're not sick and they're not getting ill with this, but they can spread it. And what's scary with the Delta is, yes, you can spread it, not so much with the original strain. And that's why testing and things were different last summer. We're finding that kids with Delta may actually spread it, and it can penetrate, again, as we mentioned, those 12 and over who have been immunized. So that's something we need to keep a close eye on.
All right, let's get to a question we have from Maria. What do you recommend for those who are unvaccinated and recently got COVID, especially since places of employment are requiring you to be vaccinated?
Well, that's a great question. From a Department of Health standpoint, once you're infected and have documented illness, you're basically considered immune for at least 90 days post-infection. So we still recommend you mask because we don't want you, again, getting sick again if there's another variant that comes through. You can work, and then what we do recommend is once you are, and even testing at that point, we don't test you in the 90 days because you can pop positive for that full 90 days. That once you're done, 10 days after the illness, we recommend that you speak to your doctor, but you get immunized. And then that will give you that higher level of protection. We found people who were sick and then immunized had a much higher level of resistance to further infection.